I would like to thank Vadigudi Foundation, Dr. Mahendra Bhandari, and the chairpersons for giving me this opportunity to speak at this August forum. And so I bring greetings from Sir Gangaram Hospital, Institute of Minimal Access, Metabolic and Bariatric Surgery. Talk which has been given to me today is Train the Trainer, Patient Safety Concerns. So why the topic is important? There was a study published in '99 which estimated the number of deaths in US because of preventable medical errors to be ranging from 44,000 to 98,000 patients per year. And this was more than deaths caused due to cancer, due to road traffic accidents, due to any other cause put together. So there are a lot of preventable medical errors, and these are the reported errors. So there are many unreported errors. We don't have any Indian data for the same. And most of these medical errors are system errors. They are not due to individual, or they are not due to any negligence on the part of one member of the team, but they are because the systems are not functioning well. And the culture of medicine is, as Dr. Guru pointed out very well, we do not respect the advice from our juniors. As surgeons, we think that we are the leaders and we are the ones who are doing good stuff. Other people don't know anything about it. So the culture of medicine is one of the big parts which differentiates it in terms of safety from aviation industry or other industries. So what are the factors which are involved in increasing the errors? Interactions with technology. As we see in robotic surgery, there's a lot of interaction with technology, and everybody is not that comfortable using it. Poor communication. Communication cannot be overemphasized for robotic surgery. The surgeon is separated from patient, and they need a very good communication in between. Stress and fatigue, human factors, lack of appropriate or standardized education or training, need for decision making. As Dr. Das Gupta very well mentioned about situational awareness and decision making. They cannot be taught to a person in just a 2-day course or a 3-month course. That has to come after a long time by a mentorship. So decision making is very important, and continued scientific advancements. As we see in robotic surgery, we have to upgrade our skills at a pace which is very fast, and that leads to many errors because many of the people are not able to keep up with the pace. The challenges which are faced in decreasing the medical errors are teaching healthcare professionals new skills and ways, what information do they need, and what are the most effective and efficient ways of disseminating that information. And a lot of speakers have talked about the various ways in which it can be done. Robotic surgery is the most advanced surgical platform and thus the most complex. And the training and credentialing has been standardized by many people who are here, but it is yet to become uniform all across the world. So what are the components of training? It's learning a surgical procedure, which you learn throughout your residency and your fellowship. Then specific to robotics is learning the equipment. And then it can be divided into either technical knowledge and the psychomotor skills, your skill set which you acquire using a console. And the team training. The team training is very important because if the team is not trained, the surgeon may be a very skillful surgeon on the robot, but he'll not be able to perform well. So how do we define training? Training is the action of teaching a person a particular skill set or a type of behavior. Behavior is also called training. What is assessment? Assessment is measurement of a learner's potential for attainment of performance. A test is a procedure which is intended to establish the quality or performance or reliability of something. And a high-stakes test is a test which has very important consequences for the test taker. So these definitions are very important whenever we talk about training and credentialing in robotic surgery and improving patient safety. So the modes of training are didactic lectures, simulation, dry lab, wet lab. All these are low-risk environment up to wet lab. You're not operating on patients, so these should be emphasized as much as possible. And then comes the proctored procedures and dedicated fellowships in robotic surgery, which continue for a year or two under mentors. So standardization of training, we have various curriculum which have been developed, and they can be either competency-based or proficiency-based. So what is the difference in competency and proficiency? A competent person has the necessary ability, knowledge, or skill to do something successfully, anything. A proficient person has a high degree of skill or expertise, while an expert is very knowledgeable and skillful in a particular area. So, and how do we validate a training tool? I want to use this curriculum, he wants to use that curriculum. How do we validate that my curriculum is good? We have to have a face validity. Face validity means the experts have to say that the content is realistic. The content validity is also a formal evaluation by the experts. A construct validity, whether I do a curriculum or an expert do a curriculum and a novice do a curriculum, is there a difference in between the outcomes by the two? A concurrent validity, if there is a gold standard, how do we compare our protocol to the gold standard? Does it fare well with the gold standard? The predictive validity, once the person has been trained on this curriculum, is he a better surgeon when he goes to operating room? And inter-rater reliability. So these are many things which are taken into account, and then there are many questions which need to be answered before you conduct a validation trial. You have to define the research question, you have to develop a hypothesis, and you have to constitute the definition for an expert, and then either a single institution or a multi-centric study has to be done. So we have been talking about the Dreyfus and Dreyfus model, and this is a very good model which shows you what is proficiency and what is an expert. So if you see the graph below shows the beginner who is 2 standard deviation below the mean of the experts. So the mean of the experts is the level of proficiency. If we take 10 experts and they perform at a level, then the mean level will be the proficiency, and the expert will be 1 standard deviation above the proficiency, and there will be outliers who will be the masters, who will be 2 standard deviation above the proficiency. So we cannot have many masters, but we have experts, and competency is 1 standard deviation below. So we feel that proficiency-based curriculums are better as compared to competency-based curriculums, especially when patient safety is concerned, because we cannot just have a competent surgeon, and we cannot have a margin of error. So this is a fundamental of robotic surgery trial, which is from Dr. Vipul Patel's group, and I was on the expert panel with Dr. Sudan, who is here as my mentor. And it had 4 consensus conferences, and the trial started with a kickoff conference at Orlando in August last year, and it is in progress in 15 institutions across the world. And it has been funded by Department of Defense, and we should be getting the results of the validation trial soon. The CRS score, the Clinical Robotic Surgery Association score, is another multi-institutional validation assessment tool which is being developed by University of Illinois at Chicago from Dr. Giulianati. I happen to be a part of that group also, and the results are just to be announced in this year. So, and European thing has been discussed by Dr. Mortry. So there are many things, there are many protocols, many curricula which are under development, but I think we need a set of protocols for Indian environment, because we know that Western environment is quite different from Indian training scenario, and how best we can apply these training courses into the Indian system is quite necessary, and that is what we are looking at. So team training, as we already discussed, is very important to prevent any errors on the part of any team member so as to improve the patient safety. For improving patient safety, the patient care pathway should be defined, the protocols should be put in place for every procedure, and regular debriefs, regular discussions by the operating team members after any procedure is completed is very important, so as to point out the errors and how can they improve after in the next procedure. And team training in communication, again and again, I think that cannot be overemphasized. This is our department at Sir Gangaram Hospital. We have a 2-year fellowship in minimal access surgery, which is accredited from National Board of Examinations, and we provide a hands-on robotic surgery training, a proctored training, because it's a long course. But we have short duration observation programs, we have wet labs, we have didactic lectures, and I think we need a structured program for the Indian scenario as well. We had this RoboSurge conference which just concluded yesterday with Dr. Ranjan Sudan coming over as the international faculty. It was a successful course with a robotic training lab, more than 100 delegates and 50 national faculty, and we had live demonstration of cases. And we don't have those IRB things happening here in India, so we can easily show all the communications which is happening in OR live to the delegates. So there was a lot of communication back and forth, and I think we can provide much better training modules with ease as compared to the Western scenario. So the take-home message is patient safety is of paramount importance. If patient safety is compromised by any surgical procedure, the robotic surgery as a field can be doomed. So patient safety has to be maintained. Standardized training in low-risk environment is the key. We don't need to learn on the patients, but we have to learn before we start operating. Team training and communication cannot be overemphasized, and validated training curriculum in respective environments of various countries is a must. Thank you so much. As Abraham Lincoln once said, the best way to predict your future is to create it. Thank you.
Thank you.